Opoku Maximus is my name. One may ask, what's cholera? Cholera may be defined as a highly infectious disease, mainly caused by bacterium vibrio cholerae, typically spread through contaminated food or water. What are some of the symptoms one can determine either he or she has cholera? One, you can determine by having severe diarrhea, vomiting, rapid heart rate, loss of skin elasticity, dry mucous membranes in the mouth, low blood pressure, and thirst. The cholera outbreak in some regions like Central Region, whereby the Ghana Health Service recorded 21 deaths as December 10, 2024. Also, the Ghana Health Service reported cases in the Greater Accra region with 9 confirmed cases in the Adan West and Adan East districts.
I am Gifty Afi Akajo, and I would like to highlight on some ways cholera can be transmitted. Cholera is mainly transmitted through contaminated food or water, drinking of polluted water, or eating of contaminated food, especially raw or undercooked food, is highly a mode by which cholera is transmitted. Also, another way by which cholera can be transmitted is through a contaminated environment. Living in areas like refugee camps, slums, where there are inadequate toilet and refuse dumps, and inhabitants are always exposed to germs, people can get infected by touching contaminated objects or surfaces and then putting their hands in their mouth. Last but not the least, cholera can be transmitted through direct contact of an infected person's feces, vomit, or contaminated clothing. This can happen through handshaking, touching, or sharing of food, water, and drinks. Lastly, cholera can be transmitted through direct contact of an infected person's feces, vomit, or contaminated clothing.
From 1st January to 29th September 2024, a cumulative total of 439,724 cholera cases and 3,452 deaths were reported globally across the 5 World Health Organization regions. And also, since 31st August 2024 and as of 23rd October 2024, 83,982 new cholera cases, 900 new deaths, which have been reported worldwide. The 5 countries reporting most cases are Afghanistan, which has 24,151 cases, and Sudan, which has 23,590 cases, and Pakistan, which has 12,954 cases, and Nigeria, which has 448 cases. Thank you.
Some causes of cholera are: 1. Poor sanitation. Inadequate waste management like toilets and poor sewage system contribute to spread of cholera. Where human waste is not properly disposed of, it can contaminate our water bodies, sources, and food. Another causes of cholera is lack of education. Lack of education, limited awareness about cholera prevention symptoms can exacerbate the problem. Education is critical in promoting health behavior such as proper hand washing and food handling. The last cause of cholera I'll talk about is lack of community engagement. Limited community involvement in cholera prevention and response efforts can hinder effective control measurement. Community must engage in clearing and making sure that the environment is well lit. Another cause of cholera is lack of community engagement. Limited community involvement in cholera prevention and response efforts can hinder effective control measures. Community engagement is critical in promoting healthy behavior support, cholera prevention efforts, facilitating access to healthcare services.
My name is Robertaya, a student of the University of Ghana, and I'm here to educate you on the effects of cholera on the community and the individual. As you all know, cholera is a very contagious disease which can take an individual's life and also bring unproductivity on the community and the country at large. So one major effect of cholera on the community is loss of life. Cholera bring about high mortality rates, which can reduce the population of the community. Cholera reduce productivity, which can bring about low income and revenue. Major effects of cholera on the community and individual is strain on healthcare system. Hospitals and clinics become overwhelmed with cholera patients, reducing resources for other illness. It creates pressure for the healthcare personnel, making them not able to carry out their duties well and properly as required. Another major effect of cholera on the individual and community at large is negative impact on the economy. There will be loss of productivity as individuals become too sick and weak to work under proper conditions. As a result, there will be low income and revenue for government to be able to use to take care of the economy.
One of the major ways to prevent cholera is by ensuring proper sanitation. To prevent cholera, one must ensure that human waste are disposed of properly, using latrines or toilets that are connected to a functional sewage system. And also, we must ensure personal hygiene by promoting the washing of hands with soap and running water after visiting the toilet, before eating, and also after caring for a sick person. Another way to prevent cholera is by getting vaccinated. If you are traveling to an area where cholera is common, consider getting vaccinated against cholera, and also make sure that your vaccinations are up to date, as this can provide some protections against cholera.